You know, there's almost nothing more stressful for a parent than when their child is sick. That feeling of worry, the uncertainty, right? It can be totally overwhelming. So today, we're going to break down everything you need to know to handle those moments with a bit more confidence. All right, let's get into it.
And this quote, it just says it all, doesn't it? Fevers and coughs, yeah, they're a normal part of being a kid, but that doesn't mean you're supposed to go through it all by yourself. Having the right support and just knowing what to do makes all the difference in the world. And there it is, the million-dollar question. Is this just a simple cold that needs some rest and a whole lot of cuddles? Or is it something more? That's the exact uncertainty we're going to clear up right now.
Okay, first things first, let's just get on the same page about something. It's really important to understand that getting sick is, believe it or not, a normal part of being a growing, healthy kid.
I know, it might not feel normal when you're up for the third night in a row, but these constant little illnesses, they're actually how your child's immune system gets all its training. It's learning how to fight off all the germs it's going to meet in life. So as tough as it is, it's actually productive.
So what exactly are we dealing with most of the time? Let's take a quick look at the usual suspects that tend to show up.
Yep, from fevers to stomach bugs, this list is basically the greatest hits of childhood sickness. And while they're super common and usually not serious, we all know they can be really distressing for your little one, and, let's be honest, for you too.
All right, this is the heart of the matter. This is the part that helps you cut through all the guesswork. Let's get into the clear signals that tell you it's time to stop wondering and actually pick up the phone. Here is a super practical checklist to help guide you. Okay, a fever that just hangs around for more than 2 days. That's a clear sign. Any trouble breathing, that's an immediate call, no question. Dehydration is a big deal, so if they're refusing to drink, pay close attention. And that last one is all about their behavior. If they're just not themselves in a way that really worries you, that is absolutely a good enough reason to get a professional opinion.
And with all those things to look for, here is one hard and fast number for you. If that thermometer reads 39 degrees Celsius, that's about 102.2 Fahrenheit, the decision is made for you. That's a critical point. That means it's time for a prompt call to your doctor.
This is a big one. This question comes up all the time, right? As parents, we just want to do whatever we can to help our kids feel better fast. And we often think of antibiotics as that quick fix. But is that really the right way to think about it? The answer is a big, clear no. See, most of the common stuff, like colds and the flu, are caused by viruses. Antibiotics, they're designed to fight bacteria, not viruses. So giving them for a viral thing, well, it just won't help. And it can actually cause bigger problems down the road.
Okay, so you've made the call and you're heading in. I get it. For some kids, and even for us parents, the doctor's office can feel a little intimidating. So let's just pull back the curtain on what a typical visit actually looks like.
It's a very systematic, thorough process. Your doctor's going to listen, do a physical exam, and then work with you to make a plan. You should really think of it as a partnership. They bring the medical expertise, and you get clear, straightforward guidance on treatment, what to do at home, and what to watch for next.
And that brings us right back home, which is where most of the healing actually happens. Because the care doesn't stop when you walk out of that clinic. In fact, that's where your role becomes more important than ever.
So here's a simple way to think about it. For stuff like colds or just general crabbiness, rest and fluids are your best friends. But you always want to keep an eye on that other column, when to escalate. Think of that as your safety net. If the symptoms are getting worse, or that fever hits that 2-day mark or the 39-degree C mark, you know it's time to call again.
And you know, after all the checklists and the temperature readings, it really all comes down to one simple, powerful truth. You know your child better than anyone on this planet. If your gut is telling you something's not right, you need to listen to it. That instinct is the most valuable tool you have. So, as we wrap up, I want to leave you with a question to think about. After hearing all this, what's one key sign? Maybe it's the length of a fever or just a tiny change in their behavior that you'll look at with new eyes next time. Because being prepared isn't about never getting sick. It's about facing it with knowledge and with confidence.